Hi, all. Thanks so much for joining us on Speaking of Making Healthcare Work for You. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and we are talking about our interview with Dr. Monique Ruberu, who is the owner of Natural Women's Health in Pennsylvania, and she helps people worldwide through some online and course programs. Dr. Monique was so interesting because she practices Naprotechnology, which is natural technology related to gynecological care. And so she said that she's really able to help people who might have unexplained infertility through recurrent miscarriage. And then she also treats typical gynecological things. But I loved that she was so intent on letting people know that just because what you're experiencing is normal and lots of other people that you know may be going through that, it's not normal to have any kind of issue. And so she's focused on trying to help the body heal and treat things through science. She is a medical provider. It is scientific medical care that she's providing, but doing it in a natural way to help your body heal. I loved her conversation. Apoorv, what was your favorite part?
Yes, Stephanie, I think you really captured it also very well. I like what you had to say about it's all science. To me, it felt when I was listening to her that it was a deeper level of science that unfortunately many of us practitioners forget, or we never learn, or we just don't have the time for because our days are so busy and we have to fill them up with patients. But yet she somehow figured out a system to slow things down, work with the women to really kind of detailed chart out their whole cycle, do some more intensive labs, do some more intensive ultrasounds, and over the course of a month, it's actually sounds like it's pretty overwhelming. It's intense, certainly for the woman, but she described it as such a beautiful process because by the end of that, you come to a much more deeper understanding based on science of what's really going on inside your body. So I just love that. I think she just had a very keen understanding of what actually is going on, and then through the scientific process she's developed a mechanism to really help people understand that. I think her closing line was also something you've got to love. Basically she said, listen to your body. Your body's trying to tell you what's going on. Unfortunately, we're just not tuned in to our bodies. We don't know how to listen. And so I think she's developed a nice methodology that is, a lot of our audience, I think, will gravitate to for understanding how do you actually just follow the course that your body's trying to tell you. So wonderful interview, Stephanie. I'm so glad that we did this one.
It was interesting to me that she was talking about the reliance of people and providers on the pharmaceutical companies and how just so many things are treated by prescribing birth control pills, and that treats all these different conditions. But really, it's just masking them because there are underlying root conditions. So it's just interesting to think of treating things by not using a pill or a drug, because usually you think, well, oh my gosh, I need something that's going to help. But she's saying, no, 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 your body probably can do something and it may need help, but we can do it in a different way. It doesn't have to be through this. So it was a really great conversation.
It truly is, because I think what it tells you, it shows you the grip of the current medical industrial complex that we're in, that's been built up over decades, probably about 100 or so years. And slowly, slowly, slowly over time, what's wound up happening is that ultimately people are caught up in their practice. Practitioners can't kind of get out of their cycles because that's just the way it's been built. The societies are also, kind of part of the standardizing current care. Improvement comes slowly, and then insurance companies kind of reinforce that because they pay for things that tend to get that work, and then pharmaceutical companies reinforce that same cycle. So when you add it all up together, you've got this big grip of the medical industrial complex, which is really, really hard to break. But it's a breath of fresh air to see someone like Dr. Monique coming out and being able to develop a new technology, a new way of approaching this complex issue.
And encouraging to hear that she said that there are lots of other doctors that are starting to use these same practices, new people coming through school, and that the current doctors are also receptive to this, that they respect her as a medical provider. So I think it's all great things on the horizon. You guys are going to love the interview with her. Dr. Monique was great. So thank you so much for watching, and we'll talk to you soon. Bye-bye.
Bye bye.